Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for today's news briefing. Joining us today, the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. First, I want to welcome back students, teachers, professors, and support staff as our public schools and universities have started a new year of learning. It's an exciting time for our young people, for their loved ones, and for everyone who's working so hard to make sure that they get the best education possible. Seeing our public school students waiting for the bus or walking to school is such a great sight, and I wish everyone a safe and successful year. It will seem like more normal this year, but we still have to be vigilant to stay safe, to stay COVID safe. While public health guides us through multi-layered protections against COVID, the best way to be safe is still to get vaccinated. Vaccination improves overall community safety, and a safe community is a safe school or university. So if you haven't gotten vaccinated yet, I encourage you to book an appointment now. It's easy, and there's a pharmacy or location in your area that will give you the necessary shot. You can get your first shot or your second shot, but please get vaccinated. So in total, today, our vaccination rate is about 72% of the overall population. And Dr. Strang and his team remain optimistic that we will reach our threshold rate of 75% by September 15th. So based on this outlook, the recommendation of Dr. Strang and Public Health remains that we continue to plan to move forward to Phase 5 for September 15th. Well, Phase 5 will remove most restrictions. We can't ignore the impact of the fourth wave and the Delta variant, the impact that the Delta variant is having around the world and across the country. That's why we'll continue to push messages that encourage vaccination, but I also know that everyone's been waiting for the removal of most restrictions for a long time, and I want to deeply thank Nova Scotians for following COVID-19 restrictions and the policies that have been in place over the last 19 months. Dr. Strang will tell you shortly about the layers of protection that will remain in place even during Phase 5. But of course, the big change is that there will no longer be gathering limits in place, and that's exciting news. It's exciting for a lot of Nova Scotians. But you'll also hear from Dr. Strang today that we must maintain the cautious approach that has kept Nova Scotia safe. And part of that cautious approach will be a proof-of-vaccine policy that Dr. Strang will elaborate upon for us today. I understand that many of us are still experiencing so many emotions over COVID, but I want to assure you that we are at a very optimistic point of the pandemic. Most Nova Scotians have gotten vaccinated, which is our best protection, and our layered approach that Dr. Strang will talk about today will continue. This is all essential with a fourth wave moving through many parts of the country as we're seeing. So yes, we're opening up further, and we're getting closer to a life where COVID will only be in the background, but we still need to be cautious. So Dr. Strang will elaborate. Thank you.
Thank you, Premier. Good afternoon, everybody. I hope everyone enjoyed their first day back to school, college, or university. And while we reported a large number of cases yesterday, I remind people that did cover a 4-day period. We continue to see daily cases, but most are travel-related or they're close contacts, and are also mostly in people who are unvaccinated. We do have a few cases that are under investigation, but there is no evidence of ongoing community spread here in Nova Scotia. However, we are seeing cases rise elsewhere. Some provinces are halting reopening plans, and others are reintroducing public health measures. The fourth wave is gaining steam, and we can expect to see ongoing COVID activity during the fall. However, I truly believe Nova Scotia is ready. We have shown we can do what needs to be done in the past, and our vaccination rates are among the highest in the world. Almost 80% of Nova Scotians have gotten their first dose of vaccine, and we're very close to reaching our target of at least 75% of the population being fully vaccinated with 2 doses. Close enough that I feel comfortable that we will reach that target and be able to move into phase 5 on September 15th. So as of September 15th at 12:01 a.m., masking in indoor places and physical distancing will no longer be mandatory, and there will be no gathering limits. It has taken a long time to get here. All Nova Scotians have worked hard and stuck with our cautious approach, and you have my profound thanks. I wish I could say our job was done, but we're not quite there yet. We need to be wary of the potential for a 4th wave of COVID right here in Nova Scotia as well. So that's why we are keeping some protections in place. First, while masking will no longer be mandatory, we strongly recommend people continue to voluntarily wear their masks indoors, especially when in close contact with others. Healthcare facilities will continue to set their own policies for masks and for visitation. And businesses and other organizations are also free to set their own masking policies. And as well, masks will be required in schools until Monday, September 20th, to allow students, staff, and teachers time to transition to phase 5. And make no mistake, required masking will also be one of the first measures brought back if cases rise in a certain area or setting. Secondly, measures will stay in place at our borders. This is key to keeping the virus out of Nova Scotia. Anyone entering from outside Nova Scotia, Newfoundland, and PEI who is not fully vaccinated will continue to be required to isolate and be tested. Thirdly, we will implement a proof-of-vaccination policy as a time-limited measure in response to the 4th wave. Requiring proof of vaccination to participate in activities that are discretionary, recreational, or non-essential means we can bring larger groups of people together safely. This gives us the best chance of staying open once we've opened. We do not want to shut the province down again. As we open up activities, businesses, opportunities, and gathering sizes that we have not had for 18 months, we need to have an additional layer of safety from a proof of vaccination policy through the 4th wave. It is how we can continue to keep our communities safe, have children and youth safely in school, and protect the healthcare system and those who provide care for us. I know there'll be a lot of questions about this policy, and we're still finalizing the details. We anticipate it will apply to activities like dining out, going to bars, going to movies, attending a performance or concert or a sporting event, or going to a fitness facility. These are all social activities that bring people together, and we know that's where this virus thrives. Unvaccinated people in these settings increases the risk of spread within a larger group and puts the unvaccinated individuals themselves at greater risk. Unvaccinated people are 36 times more likely to be hospitalized due to COVID, so they need to be very careful about their own exposures. People have until October 4th to choose to get vaccinated. That's when this policy will take effect. So if you can't, starting on October 4th, if you can't show you're fully vaccinated, you will not be able to participate in these non-essential activities. Children under 12 who attend these activities with fully vaccinated adults will be able to participate, as will those who have proof of a valid medical reason why they cannot receive COVID-19 vaccines. There are only a few such medical reasons, and healthcare providers will be able to give certification only for these few reasons. Anyone who has received one or both doses of vaccine through the provincial immunization program already has access to the Nova Scotia COVID-19 immunization record. And for now, this will be the proof required. and this record can be accessed on your phone or printed. Nova Scotians who received one or both doses outside the province or through a federal program, such as the Canadian Armed Forces, will have to show the immunization record from the jurisdiction or program where they received their vaccine. And in some cases, this could mean that they have to show a record for each individual dose. We are working on a digital record for all Nova Scotians and on a solution to integrate doses received outside the provincial program. And we'll have more to share on that soon, and we anticipate to have that process in place around October 4th, so people can start to get that Nova Scotia proof of vaccine, even if they were immunized through other processes. There will be no option to provide proof of a negative test. Testing has an important place in our COVID response, but a negative test result is not an alternative to being vaccinated for participation in non-essential activities. I know some Nova Scotians are still uncomfortable receiving COVID vaccines, and I want to be very clear, we are not requiring anyone to be vaccinated. You will remain having a choice. But we are still in the midst of a global pandemic that has taken countless lives. And an individual's right to choose has to be balanced with our collective responsibility to keep one another safe. And I believe this policy provides an appropriate balance. Let me go back to our border measures for a moment. Starting September 9th, unvaccinated people who have traveled within Canada and enter Nova Scotia no longer need to isolate for 14 days. They must isolate for at least 7 days and cannot leave isolation until they get 2 negative test results. And those tests should be on day 1 or 2 upon entry and on day 5 or 6, so they can have a result by day 7. The vast majority of travelers are fully vaccinated, so we're comfortable that this approach is enough to protect Nova Scotians. International travelers will continue to follow the requirements of the Federal Quarantine Act. However, starting September 9th, international travelers no longer have to complete the Nova Scotia Safe Check-in form. The federal government has increased its monitoring to ensure that international travelers are meeting their federal quarantine and other requirements, so our Nova Scotia form is no longer required. And I also wanted to mention something that may motivate some people to get vaccinated. Effective immediately, people who are fully vaccinated do not have to self-isolate if they are identified as a close contact of a COVID-19 case, unless otherwise directed by public health. And when we say fully vaccinated, we mean optimally protected with 2 doses of Pfizer, Moderna, AstraZeneca, or a combination of these vaccines. Anyone with doses of other vaccines not approved by Health Canada or a single dose of the Janssen vaccine would not be considered optimally protected. And that's why we're making an additional dose of the Pfizer or Moderna vaccine available to anyone in these situations. At this time, we're only making 3rd doses available for this specific purpose. We do anticipate a NACI recommendation for 3rd doses for people with specific conditions that make them immune compromised in the near future. And then once we get those recommendations, we will implement them here in Nova Scotia. I know that's been a lot of information for today, but there are a few points that I think are worth repeating. First, please get vaccinated. There is no better protection. The impact the Delta variant is having in places with low vaccine rates is proof the vaccine works. Yes, we will still see cases in vaccinated people. The vaccine isn't foolproof, but it is highly effective in preventing severe illness, hospitalization, and death. Second, as of October 4th, proof of vaccination will be required to do certain things. For most Nova Scotians, this policy won't change much. For those of you who have not gotten vaccinated, you will remain having a choice. I know there will be divided and strong views on this policy. My appeal to all Nova Scotians is that we not let this issue divide us like it is elsewhere. Please continue to treat one another with respect and kindness, regardless of somebody's ultimate choice. And let's base our actions on what is needed to keep each other safe. I don't expect everyone to agree with public health recommendations all the time. We've asked you to do things that are not easy. but we've always put the collective well-being of Nova Scotians first. And I want to end with a thank you to all Nova Scotians. Your hard work means we will enter Phase 5 on September 15th. We will still need to practice the basic measures that have kept us safe, but masking and physical distancing will no longer be mandatory, and there will be no gathering limits. Our slow and cautious approach has kept our case numbers low and allows us to reopen our province safely. Thank you.
Thank you, Dr. Strang. Just a reminder for those reporters in the room and on the phone, we'll start in the room first for a period of time, and then we'll go to the phone lines and take some questions from the phone, coming back to the room. Go ahead.
Dr. Strang, I'm having a hard time understanding how we get to 75% in a week when we're at 72% right now, and the double dose is rising maybe 1/10 of a percentage point a day.
So yesterday, based on appointments we had booked till September 15th, we were at 73 point something percent. Today, our projections, even overnight, there's been a bump in people making appointments. We're now at 74.1%. We can expect that over the next few days, that trend. So I'm fully comfortable and confident that we will get to that 75% by next Wednesday, given the trend we're seeing in the last day or two, even of a continued increase in people coming forward for vaccinations. Yesterday we had the largest number of people coming forward for their first dose of vaccine that we've had since early August. So we continue to have lots of people coming forward.
If we aren't at 75% though by next Wednesday, like, is there a chance this could be delayed? PEI just announced yesterday they're delaying their Phase 5. What happens if we're at like 74% or 74.1%?
We'll continue to look at that. I mean, I'm confident that based on our numbers, we also have to understand that what we don't have, because we can't enter their individual data into our system, we have another 1 to 2% of people that we know there's between 8,000 and 9,000 Canadian Armed Forces members who all we know are all fully vaccinated. For privacy and other reasons, we can't actually have them in our system, so they're not part of our official number. So there's a bit of a margin of error there as well. So, but I fully believe that we're on track. That even without that margin of error, we're going to get very close, if not at that 75% or beyond.
Just to be clear, if we're not right at the 75, it could still go ahead next Wednesday.
We'll continue to have conversations with the Premier's office about again, everything we project on our appointments, and it's always shown through that I'm very comfortable that we are going to be where we need to be to safely go to Phase 5 by next Wednesday.
Premier, do you think there's any chance that we might walk that back and not meet Phase 5 next Wednesday?
No, I mean, we've been pretty clear. 75%, that's the hurdle. When we reach 75%, Phase 5. And here we are a week away, and public health has every confidence we'll be at 75. But 75 is the hurdle, but there's a high degree of confidence that we'll meet that, so we're planning for that.
Remember, I noticed that nobody's using the phrase vaccine passport today, but this sounds a lot like a vaccine passport. Why are we not calling it that? And if it's not that, how is it different than that?
Well, I guess words matter. I mean, this is a policy, and it's a policy that's designed to keep people safe, just like all the other policies that have come from public health. So that's the reality. It's a policy that will keep people safe. So that's what we're calling it, the proof of vaccine policy. I mean, other people may want to call it other things, but I was pretty clear during the campaign, and anytime I've been asked, that we pay a great amount of respect to Dr. Strang and his team at Public Health. And when people look at what's happening with the fourth wave, they look at the Delta variant, there's certain things we need to do to keep people safe, keep Nova Scotians safe. And one of them is to have a proof of vaccine policy, so that's what we'll have.
To what extent did you see this as being, or for either of you, did you see this policy as being necessary given that you're about to remove the masking mandate? We still have a lot of people in this province, because of their age, who cannot be vaccinated.
So I think that's the primary reason. So it's not the masking mandate, but it's the gathering limit. So given the fourth wave around us and the issues around the infectious nature of the Delta variant, so if Phase 5, where all of a sudden we're going to allow much larger numbers of people to come together. My argument is to do that, and there's lots of reasons why we need to do that, business and other reasons. We have to allow have, for the limited period of time as we get through the fourth wave, that it has to be vaccinated people who get together in larger numbers for non-essential activities. It's just a necessary additional layer of safety. So it allows us to continue the path on opening up, but with a necessary layer of safety to do that, given the evolution of over the last month or so around what we know about the fourth wave here in Canada.
Go ahead, Paul.
Would you say part of it, though, is to help encourage the unvaccinated to get vaccinated if they can only participate in these things by having that proof? Is that not a motive as well?
I mean, that's certainly in other jurisdictions. I know in British Columbia they announced it, and then they had right away they had a threefold increase in people looking for vaccination. That is certainly a very a positive, I'll call it a side benefit, but we're not doing this to push people to get vaccinated. We're doing it because it's a necessary layer of safety. If the impact of that gets more people, convinces more people to be vaccinated, well, that's good too.
Dr. Strang, you're saying that this is intended to give us a layer of protection as we take the mask mandate off. But we know from what we're seeing with the fourth wave and with Delta and with Mu that this virus still spreads pretty freely even if you're double vaccinated. And so why, if we are taking off the gathering limit and we're like, is the proof of double vaccination security enough when we're allowing people to not socially distance anymore and take off their masks?
So it depends on the level of virus circulating. So right now we have no evidence at all. In fact, we have good, there is no general circulation of the virus here in Nova Scotia. Doesn't mean we can be relaxed, but I'm comfortable that as long as we stay that way, that we don't need to have mandatory masking. And I think that's an important point. We're still strongly recommending Nova Scotians to keep masking, especially in indoor places when they're around other people who are, especially if we're not from their household. It's really important that Nova Scotians do that, but given where we're at with the virus epidemiology, I don't think it's justified to have a mandated measure. We always have to think things that are proportional to the circumstances. But make no mistake, and I've had this conversation with the Premier, if we get evidence that we're starting to get local spread of the virus in a community, in a certain workplace setting, that one of the first things that we will bring back in response to that in that setting or that local community would be required masking again as part of a time-limited control measures in that specific circumstance. Because then the masking, a higher standard for masking is necessary because you now have evidence that there is the virus circulating in a community.
You see provinces across the country now doing steps along these lines over the last couple of weeks. What have you taken away from what other provinces have done that you either liked or you didn't like that you incorporated into this policy that you're releasing today?
So I think two things. The lesson when looking to other provinces is they release public health measures when they had what I would call not sufficient levels of vaccine coverage rates, and then they've gotten themselves of a recurrence. So that's why we're all along. We have to hit a target of fully vaccinated before we can go to phase 5. But we've also, learned that this is all about a balance. So we're not saying that people will not be able to go to their church, their mosque, that they will not be able to go shopping, they won't be able to go see a doctor. Those are essential, and the people will still be able to do that whether they're vaccinated or not. What we're saying is that non-essential or discretionary activities, because of the greater risks of the fourth wave, finding that balance of still giving people choice, but also putting things in place that protect our collective well-being, having this kind of a proof-of-vaccination policy for non-essential activities is an appropriate balance between the individual choice and our need to keep each other safe.
10 of today's 10 of today's 14 cases were people under 19. I'm told there's a school in Dartmouth today is reporting a case. Do you still think the school policy is working? And since there were 8 of the 9 cases in the northern zone were people under 19. Is that an outbreak in a school, or what can you tell us about that?
That's a unique cluster of individuals with close connections with each other. It's not an indication of any spread in a community. That's a very well explained circumstance of a group of individuals with very close contacts with each other. I've said all along, we're going to get cases of COVID in schools. It's day 2, we've had a single case. That's not a failure at all. We're gonna get cases in schools. We have an appropriate responses to that.
I asked you some weeks ago if we could start getting data for the 11 and younger versus the 12 to 19. There's a lot of anxiety about that younger group out there. Can you give us any insight as to whether today's cases are people under 12 who are unvaccinated or over 12, or what can you tell us there?
Yeah, and I've been reminded, I've asked we need to start doing that. That is an absolutely legitimate piece that we need to break that down. Today's cases, 4 of them are under 12.
Dr. Strang, I'm wondering, you mentioned border measures are going to keep up even in phase 5. But on the holiday Monday, arguably one of the busiest travel days, especially people coming back to the province from other maritime travel over the long weekend, the province has told me that the border checkpoint was shut down for 4 hours because of too heavy traffic. There were too many cars coming through, so they didn't stop any of them. Is there a worry there that unvaccinated people may have come through and not been told to isolate, things like that? Premier, if you can speak on that as well, either of you.
There's 2 things there. We've had ongoing discussions that we need to rely on, and we're balancing public's health, but we have to be clear we cannot create a public safety risk on our highway. So from the very beginning, we've given the ability for on-the-ground border staff to open or close that 3rd lane that checks people based on volume. We just have to do that. But that check is exactly, it's a check. People still, everybody coming through, even they may not have been checked, has to go through and would have had to do their safe check-in online, and would have had to provide proof of vaccination online to do that. And our experience all along is the vast majority of people are doing that, and there's no problem at all when we do the check-in. So I don't think that when we temporarily have to close down that check-in lane to make sure we have traffic and public safety is not creating, I'm not concerned that there's a major risk resulting from that.
Can you just reiterate for people, a lot of folks are just seeing this online now, how would they show their proof of vaccine when they go out to non-essential events? Is it they just printed off the email that they got?
So right now, if you're immunized through the Nova Scotia program, you would have gotten an email that says, here's where you go, click on a link, and you can either, and it gives you a little proof of vaccine. You can take a photo of that, keep it on your phone. My wife, for our family, she printed them all off, and I have a nice little laminated card in my wallet, right? So there's lots of ways you can do that. And what we're working on also is, like the Canadian Armed Forces, who were immunized through a federal program, people who were immunized outside of the Nova Scotia program. We're working right now so that by October 4th, we will have a program. It may not be fully implemented, but they will be able to give their proof of immunization into a system that will then give them a Nova Scotia proof like I have right now.
Just a quick one on a different topic. You created the position of healthcare professionals recruitment. I guess this would be for the Premier. Are you going to open more seats in nursing programs to accommodate the people who are on wait lists to get into these programs?
Yeah, there's ongoing discussions there. Actually, I'm pretty excited about the work that Dr. Orl is doing right out of the gate on recruitment and retention. But certainly, an element of that is training more people for appropriate professions. So those things are all on the table. I mean, we're committed to fixing healthcare in this province, and that's going to require trained healthcare professionals through a number of different avenues. So we're focused on it.
We'll take a few more questions before we go to the phone lines. Go ahead.
Dr. Strang, you talked about the concerns about the 4th wave. At the same time, you're talking about lifting these restrictions hopefully next week. And I know the proof of vaccine policy is one way to address that, but moving forward, what would the threshold be to re-implement masking restrictions, gathering limits?
So as I've said all along, we look at a number of indicators. If we start to see the signals from our case follow-up, from public health, local public health, that we're getting cases that we can't readily explain what was the source of exposure. If that number of those starts to increase, or if we actually see cases which we know the only explanation is exposed here locally. We're also looking at things that we look at what is the average number of contacts per case that we have. So a lot of it is you're looking at our case numbers and the context with any of those cases. That we look at the epidemiology every day. And we put all that together, and it would be something that is giving us concern that we're now seeing clear evidence that there is ongoing transmission in a community, or maybe it's a single workplace. That all of those, then we'd say, we have a little outbreak of COVID in that setting or that geographic area, and we need to add additional measures. The whole point is being that we will act quickly with a focused, targeted approach to minimize the chance of that becoming much broader spread. Our whole point is that we want to, if at all possible, avoid tough cross-the-board measures that we've had to use before, and I think our high vaccination coverage will give us that opportunity. But we will see that we're going to, over the next few months, have some of these focused, targeted kind of interventions in a limited way.
You worry about putting the onus on individual businesses or organizations for be it mask wearing or presenting proof of vaccination? I mean, a business has a lot less power when it's just them saying, please wear a mask, than saying the government is making you wear a mask.
So we're not asking businesses to be, if they want to keep masking and encouraging people to mask, but we're asking that. My message is to Nova Scotians. Keep masking. We're not downloading that to business. We haven't left a proof of vaccine policy to businesses. We're taking that on provincially from a consistency perspective, and then we need to provide leadership in that area.
We're going to go to the phone lines now. We'll start, just a reminder too, for those of you on the phone, I'm hearing that someone isn't on mute. Please make sure you're on mute unless you're asking a question. We'll start with Danielle Edwards from the Canadian Press. Go ahead, Danielle.
Hi, yes, this question I think is best directed at Dr. Strang. I wanted to ask a bit about the 9 cases in the northern region that were announced today. What can you tell us about that group? I believe the release said that they were all close contacts with one another?
Yeah, so that's exactly right. As I said to a previous question, they have very close connections with each other. I'm not going to go into any more details for privacy reasons, but we know that that group, even though it seems like a large number, there's a ready explanation. There's no indication there that is because of general spread in that part of the province.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, I'm just wondering, if we get a case in a school, what will be the response? Like you said, that in certain circumstances, if there are cases in a particular area or in a particular setting, that the masking mandate will be reintroduced. What will be the criteria in the school for that to happen?
So we'd have to have evidence of there's ongoing transmission in the school, multiple cases. As I said, we've had a single case today in a school. We identified that. There was communication as appropriate to both the families, the students, and staff in that school. There was a single classroom identified. My understanding from local public health, all the students in that class have been sent home. They're to be tested, and they have to stay home until they get a negative result. It would only be if we had multiple cases and evidence of ongoing transmission in a school setting that we would have to go to increased measures like reinstituting required masking, etc.
Next, we'll go to Pascal Reichnag, Radio Canada. Go ahead, Pascal.
Hi, I'm just wondering why the the proof of vaccination policy will only get into effect on October 4th, so that would be a couple weeks after phase 5. So I'm wondering why those two are not coordinated.
Sure. Well, I'll start, and then maybe Dr. Strang can. But there's a couple of reasons. One is to give an opportunity for people to prepare for it, and the other one is just to make sure that everyone is in the system. And I think it's just a signal to people that the variant is there, and we need to continue to take precautions. But Dr. Strang, you have a...
Yeah, this is no different. Every province has taken the same approach. BC, where they announced their policy on August 23rd, and it comes into effect September 13th. So every province has, for the reasons the Premier's just articulated, given that space between the announcement and the policy coming into effect.
Next, we'll go to Chelsea Gould from the Herald. Go ahead, Chelsea.
Hi, thank you. Dr. Strang, other than the military workers, could you clarify what groups aren't counted in vaccination numbers? I'm hearing of people like correctional officers, prisoners, rotational workers, and snowbirds. Could you clarify?
So there's two main groups. People who are immunized through a federal program. The federal government, for some federal, they call them federal populations, so corrections, military are the main ones. They had their own program. They administered their own vaccine. We do not have the ability to, for privacy and other reasons, because to enter into our system to be counted as part of our numbers, we'd have to have individual level data, which means disclosing people's personal health information. So we're working at other ways to do that. The other ones are people who may have been immunized. Maybe they were, as you said, a snowbird. I'll use that example. Maybe they were immunized down in Florida, and now they're back here. What we are working on, as I said earlier, is a process that we will have in place as we get towards October 4th. So individuals who weren't immunized through the Nova Scotia program but are now here in Nova Scotia can provide our program that information, which will, and they're doing it, this is why we can get it, if it's their choice to give that information, we can then enter it into our system, and then they will get the Nova Scotia immunization program proof of vaccination. It also means that we can add them officially to our vaccine numbers as well.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
My questions have already been asked. Thank you.
Okay, great. We'll come back to the room.
What will asymptomatic testing look like when we move into phase 5?
So we're going to focus our asymptomatic testing through our workplace program. You have to understand when people who are fully vaccinated and don't have any symptoms, there's actually a very low likelihood that they have COVID. Right, especially given our current epidemiology. But we still do need to have some asymptomatic testing for surveillance purposes. We got to be looking for it. We have over 300 workplaces that are now doing ongoing workplace testing using the rapid tests, and we're now implementing along with workplace the ability for them to take a test home and potentially and do that as well. So between the several thousand tests will be done on a regular basis between those 300 workplaces, and they're spread across the province. That gives us a strong surveillance network that if we start to pick up positives through that, that we would then move in with some additional testing. Say there was a workplace in a community outside of Halifax, and all of a sudden we got a couple of positives in the workplace. The first thing we're going to go do is start to do some more aggressive testing in that community. We also have the symptomatic testing, and we have a low threshold for symptoms that anybody with cough, a new or a worsening cough, and or 2 or more of fever, sore throat, headache. There's, through the 811, the list is there. So we're going to be testing lots of people with, who meet the symptom cluster, so that workplace asymptomatic testing plus our symptomatic testing, I'm comfortable that gives us a strong surveillance network. We don't need to be doing general asymptomatic testing as we move into phase 5 like we have been doing in the past. If things change and our epidemiology changes, we may have to, again, as part of a focused, targeted approach, do more aggressive general asymptomatic testing.
Why not in schools?
There's logistics there around getting all those individual tested on a regular basis. We've chosen to focus on our workplace testing as a surveillance system, which is an indication of any virus activity within a community.
Those pop-up testing sites will be closed, or they will continue?
we're going to be scaling those back. As a general asymptomatic testing, we're winding that down and won't be available for the general public.
And the home testing kits, I personally have found them quite useful. Will those be readily available?
We're using those mostly in our workplace testing. We're doing those on our own. We have to put those kits together through the lab, and there's quite a human resource cost to that. We're still waiting for Health Canada to license home testing kits that we could then make those more broadly available if and when they're licensed through Health Canada.
I'm wondering what supports you will put in place for businesses and venues to enforce this proof of vaccine policy. When a guest walks in the door, if they put up a stink about having to prove that, that effectively comes down to the business enforcing it. How are you going to support businesses and venues?
We'll talk to the associations on what's the best way to do that. That's part of the thing, that's part of the benefit of having a little time lag in between. But from my experience and from my understanding from general discussions, most of the operators are content with this. They want this. So we'll work out the logistics of that. But we're trying to be supportive of them, not kind of download on them. So we'll work out any logistics around that.
We'll go back to the phone lines. I'll come back. We'll go back to the phone lines now for a few more questions. Danielle Edwards, Canadian Press, do you have another question? Are you still there?
Yes, I'm still here, but I no longer have any questions. Thank you.
Great. John McPhee from the Chronicle Herald. Anything else from you?
Yeah, thank you. Just a quick question on, do we have a sense whether there will be more restrictive policies in terms of protection in long-term care, even in phase 5?
No, we're lifting our any restrictions or in long-term care, like everywhere else, are lifted. We're certainly still in staffing throughout the healthcare system. Staffing is still required to be wearing masks as healthcare providers and following other infection control measures. We still strongly encourage people who are visiting their relatives, loved ones in a long-term care facility. It's very important that A, that they don't do that if they're unwell, and B, that if they do that, we strongly encourage them to continue masking, make sure they do good hand washing, be careful about very close contact. All those precautions are still important. Ultimately, individual long-term care facilities still have to manage the number of visitors at any one time, and they still may have their own requirements at an individual facility level to help them manage visitors and maintain necessary COVID safety.
Pascal, any more questions?
All good on my end, thanks.
Great. Chelsea, anything else from you?
Hi, yes, thanks. After we get to the 75% vaccinated, will there still be as aggressive of a push to get remaining people vaccinated as the clinics wind down?
Absolutely. We've always said 75 is the minimum threshold. That we ultimately, right now, about 10% of our population can't be vaccinated because of age. And there's maybe a few, a very small percentage you can't with true valid medical indications. We'd like to get up to as close as we can to that 90%. The remaining 90% of Nova Scotians, roughly, who can get immunized. We're almost at 80% with at least one dose, but we still need to keep pushing. Every percentage is another of coverage is another 10,000 Nova Scotians who are vaccinated. So we're not going to rest just because we get to the minimum threshold of 75.
We'll come back to the room for 2 questions. Go ahead, Victoria.
I was just wondering also about kind of the vaccination clinics and winding down. The IWK said this week that they were going to remain open. Is there kind of a date set for when that will slow down as it was supposed to? I know they were surprised they were still getting so many.
There's still some demand, especially on the peninsula with university students, so we kept that open longer. But clearly, where the volume of people now looking for vaccination, it doesn't make sense to have big community clinics with big staffing that we can redeploy those staff to other parts of the healthcare system. We have a network of close to 300 pharmacies is going to be our main delivery mechanism in every community, so there's still very good access. Pharmacies are working very collaboratively to make sure communities have 7-day-a-week access through a pharmacy across the province.
Sorry, Dr. Strang, can you just clarify one more time? When there is a positive case in a school, what is the isolation requirement before folks can go back to school if they're a close contact?
public health does the follow-up. In general now, we're saying in a general, if people are judged to be very high-risk contacts, then they would have to be sent home for off for 14 days. But for general contacts, just general contacts in the school setting, most of them will not be judged to be high risk. And we're saying that those ones have to go home, get a test done, and they have to be away until they get a negative test back.
One negative. Thank you.
Dr. Strang, the border checkups we were just talking about, do those continue in phase 5?
Absolutely. We've said part of what we keep ourselves safe in Nova Scotia is we need to maintain our border measures to limit the introduction of the virus into the province.
That's all the time we have for questions. Go ahead, Premier.
Thanks, everyone. I know there's still a lot of concern and anxiety and a lot of fair questions asked today. But it's an exciting time. I mean, we're hitting a significant milestone in the pandemic here, and it's exciting that people can get out without the gathering limits, and we're still obviously encouraging the wearing of masks, but no longer mandatory, and we'll continue to. And Dr. Strang and his team are only have one objective, and that's keep Nova Scotia safe, and we're all on that same page. So I appreciate the work that Dr. Strang and his team are doing, and that Nova Scotians are doing. So onwards and upwards. Thank you.